My name is Alex Detwiler. I'm an orthopedic spine surgeon here in Stillwater, Oklahoma with Ortho Oklahoma Spine and Specialty Clinic. We're here today to talk about a commonly overlooked reason for low back pain, the SI joint. The sacroiliac joint is a large weight-bearing joint. It connects the spine to the pelvis. It's stabilized by some of the largest ligaments in the body as well as muscles. Some other causes of SI pain are degenerative, similar to other large joints in the body, as well as trauma. Childbearing can be a cause, as well as previous lumbar fusion. In my practice, roughly 20 to 30% of patients that come in with this chronic back pain that won't go away, they end up having SI joint dysfunction. Majority of people come in with low back pain, sometimes radiating into their groin, down into their leg, bilateral or unilateral. They'll end up pointing to their SI joint, which is just off the midline, low back, right about the belt line. Listening to their story, it's clear that this isn't just a typical low back pain. And then through a physical exam, after that, I'll typically have them go for a diagnostic injection with an interventional pain specialist or a anesthesiologist to numb that joint. Typically, they'll have roughly 75% or greater reduction, thus confirming the SI joint as their main pain generator. Once I put a patient through a multitude of tests to confirm that their SI joint is the pain generator, then they'll come back to the office and discuss the multitude of treatment options, ranging from activity modifications, medications, physical therapy, further therapeutic injections, and then at the end, if they have failed all this and they continue to have SI joint pain, then we can always discuss surgical intervention. In my hands, I use the iFuse system. The 3D printed triangular implants allow for adequate and immediate stabilization of the joint. As they're inserting, they pick up bone to allow for greater fusion. The surgical procedure itself takes roughly an hour. Typically, patients are going home that night. I'll see them back in the clinic within 2 weeks. At that 2-week appointment, they are constantly saying how happy they are and wish they had done the procedure sooner. Not only are my patients saying that they're very satisfied and happy with the procedure, there's been roughly 80 papers peer-reviewed that show that the safety and efficacy of the implant system, as well as the results that I'm seeing, are holding throughout the years. SI joint dysfunction is a common cause of low back pain and that is often misdiagnosed or missed altogether. If you feel like this is what is causing your low back pain, please call the clinic and schedule an appointment. I'd love to see you.